Hey guys, I am so excited to start off a series that we're going to be running for the next couple of months and hopefully a long time to come with the Victory Center's Perrysburg location inside Mercy Health. We have this amazing resource at our fingertips. And with that being said, Amanda Dove is joining me today to talk a little bit about a program that Mercy Health offers. Amanda, tell me a little bit more about your role, especially within the survivorship program.
Hi, Kim. Thanks for having me today. I have been an RN since 2007, so a little over 14 years now. I'm also an advanced oncology certified nurse practitioner for almost 2 years now, and I am actually coming up on 2 years as the survivorship coordinator at Mercy Health. I began in January of 2020.
It's really special, and this is something that not everyone is going to be able to find in their community. So if someone is looking for support from this program, let's talk first about who qualifies. What is a survivor to you, and who would be that first person that you want to jump in on this opportunity so you can help?
So an individual is considered a survivor actually from the time of diagnosis through the remainder of their treatment and through the remainder of their life, really. So there are actually three phases to survivorship. There is acute, extended, and permanent. And extended survivorship is what our program at Mercy focuses on. And that actually starts at the end of initial treatment and goes through the months after. So typically when patients are about 6 months out of treatment, which could be surgery, radiation, and or chemotherapy, they are automatically referred to our survivorship clinic.
That's really special. And this is about making sure that somebody is coming out of that cancer journey, but still knowing they have someone there to rely on. They have resources available to them, and they have someone to talk to. I think that's really important, especially when cancer survivors go through the treatment aspect of things. We want to make sure that we're taking care of everything else as well.
Sure. Yeah, and survivorship really, it includes issues. A lot of patients, they go through treatment, they have a lot of long-term and late side effects. And patients aren't really familiar with those, or what to look out for in the future and that kind of thing. So a survivorship is a time for us to kind of sit down, do a debriefing. Let's take a look at everything that you've been through, and let's talk about those side effects, what you're experiencing now and what you may experience in 10 or 15 years down the road.
Absolutely. And Amanda, you shared this document with me, and I think what's really special here is especially that little bit at the end. Family members, friends, and caregivers are considered a part of that survivorship experience. A lot of folks go through that cancer journey with different levels of support from the people in their lives, but talk a little bit more about what your experience has been like when someone comes in with their family members, whether it's, a spouse, a loved one, even their kids who are sort of walking through that journey with them.
Yeah, and especially like I said, I started this in January of 2020. So we've had the pandemic come, and a lot of patients have felt very isolated during that time. And we, obviously patients are allowed to bring one caregiver with them at a time. And those caregivers have expressed a lot of questions and a lot of concerns that they didn't feel comfortable actually talking to their loved one about, the cancer survivor. And I've actually had conversations with patients and their loved ones during the visit, and have been asked to call loved ones on an individual basis to further discuss questions that they have. So caregivers play a huge role in our patients, obviously in our patients' health, and we want to make sure that we're involving them as much as possible.
And continuing health, right? If you go home to a household that has bad eating habits, dietary restrictions, but you're coming off of a cancer journey, you want to make sure you're surrounded with people who are fully in support of making sure that they're moving forward, making the right choices. And sometimes people don't even know what that means. What's the right choice, a good choice, a societal choice? So it all kind of ties together, doesn't it?
It does, definitely. A lot of patients don't even realize questions that they necessarily have during the treatment until it's ended, because you go from diagnosis and then you start your treatment. It's, one thing after another. And finally, once the treatment's ended, that's usually when when they have all the questions, that come up, which is, a great time to address those, during survivorship.
Oh my gosh, you have so much on your mind when you're going through treatment. I can't imagine thinking of all the questions you might have at that time And for a lot of folks, looking ahead to that moment of survivorship, sometimes it's just one day at a time.
Exactly.
Amazing. So Amanda, we have some bullet points on here, and I want to talk about this a little bit. Day in the life for you during a survivorship visit. What will you do as the Survivorship Program Coordinator?
Okay, so a survivorship visit is actually just a one-time visit with myself. Lasts anywhere between about 45 minutes to an hour. And during a visit, a patient can expect to get a survivorship care plan. And within that survivorship care plan, it lists all the healthcare team members, cancer diagnosis information, genetic testing results, a treatment summary, and a follow-up care plan of kind of what to expect for follow-up with the oncologist and any imaging or testing that might be needed over the next 5 years. A patient will also be provided with extensive education on possible physical and psychological long-term and late effects of treatment. We'll also go over signs and symptoms of cancer recurrence. I also give guidance on diet, exercise, and health promotion activities. And then I do provide a list of community and national resources. The Victory Center is obviously a huge resource for us in the area. And I also provide patients with a calendar, a monthly calendar of what the Victory Center does provide for that month with different support groups and activities as well. And then I'll also perform a comprehensive review of systems and physical assessment to assess for both physical and psychological treatment-related side effects. And then based on the patient's needs, appropriate referrals to specialists may be initiated as well.
Okay, I gotta stop you there because you mentioned the Victory Center. We have people who come down here and they'll honestly say, I'm sitting in our Perrysburg office now. They're like, oh yeah, down the hall. They told me to come down here. And I love that connection because it's, sometimes it's intimidating for anyone, let alone a cancer survivor, to walk through a door. You see that handle out in front of you and you can outstretch your arm, but without that push from our nurse navigators, our survivorship coordinators, our doctors, our oncologists, our family members, sometimes you don't walk through that door without that push. So we love the connection we have with you guys at Mercy Health. Most importantly, this program is growing. It's evidence-based, it's, providing education. And now, instead of just in the Toledo, the Perrysburg locations, there may be an opportunity for folks across the rest of Northwest Ohio to take advantage.
That's correct. Yeah, very exciting.
So we have potentially a nurse navigator who's going to be starting in Tiffin and even in Defiance really shortly.
Possibly, yes. Yep. So our survivorship program is expanding. It'll be a little bit different format over there. There's smaller rural communities. So it'll be RN based versus seeing myself as a nurse practitioner, but they'll obviously still get the same great care and the same survivorship care plan, which really is really important to have going forward. If a patient moves or anything like that, you'll have that survivorship care plan with everything that another provider would need to know about your cancer diagnosis. So I'm really excited about everything growing.
It's incredible. And I'm going to ask you one more question and then we'll wrap things up. Where does your passion come from? I've only just recently started with the Victory Center, and it's already felt like such a whirlwind of love, hope, care, some heartbreak. But there's so much that goes into making sure that someone who's going through that cancer journey feels taken care of. So I wonder, where does that come from?
So like I said earlier, I've been an RN since 2007. And I actually, as a student, I worked in an oncology inpatient unit. And right off the bat, I just loved, the patients. There was just something about a lot of patients diagnosed with cancer they just have this drive within them that just gave me so much passion and, so much love for oncology and for those patients. So I did work in a couple different areas throughout my career. And then I decided to go back to school to become a nurse practitioner. And at that time I worked in our outpatient infusion center. And I also worked at a little bit smaller of a hospital, but we saw these patients and obviously, they're coming in very frequently and they become like family to you. I mean, obviously there's some really great stories and some sad stories too, but these patients call you by name, they're asking, about my loved ones at home. I'm asking them about theirs. It's just like an extended family. And I've had a few family members also, have cancer as well. But I've always had just a huge passion for oncology, and this is definitely where I see spending the rest of my career in.
Mm. We love talking to you today. It's honestly so refreshing to know every step along the process that there's a face you can attach to that part of the journey. And
Yes.
people are going to see your beautiful face if they get
Oh,
involved
thank
in
you.
the sponsorship program or the survivorship program, pardon me. If someone has an interest, what is the best way to find you and to get started?
Okay, so the best way, Lisa is our, she mans the phones in the nurse navigation office. So she actually does all my referrals. So she would be the first point of contact.
Mhm.
I can provide you with her phone number. It's 419-407-2345. And if you wanted to speak to me directly, my direct line is 567-368-1547. So I would be
Amazing.
happy. You could either reach out to Lisa or me directly. I'd be happy to help anybody.
It's kind of amazing. I mean, and there's something really special about the fact that you are happy to make yourself available. You know,
Oh, yeah.
so infrequently do you find someone who's like, call me. I'm the person, I'm the one, call me. So I love that. I love that you're accessible to your patients, and hoping to move more people through survivorship very, very soon.
Yes. Thank you so much, Kim. I
Thanks,
appreciate your time.
Amanda.
All right.